I was born in Yazoo City, Mississippi. Went to Millsaps College, where I obtained a degree in chemistry in 1984. Proceeded to the University of Mississippi School of Medicine and obtained my Doctor of Medicine degree in 1988, after which time I began a residency in general surgery, and after that I made the decision that I would like to specialize in otolaryngology, head and neck surgery, and pursue my residency at University of Mississippi Medical Center. Well, since the time I was a teenager, early teenager, I knew I wanted to become a physician, specifically a surgeon, and I was geared to that all along. Started doing research in the Department of Surgery while I was in college and was exposed to a lot of surgery at that time. Back in those days, I was allowed to go to surgery even before starting medical school, and was exposed to a great variety of different types of operations. As I proceeded into my residency, I decided that I would like to specialize into an area of the body that's very complex in general, the head and neck region, and felt that that surgery was very rewarding in a lot of different ways. I could treat a lot of pediatric and adult patients alike. Well, the field of otolaryngology, or ENT as it's more commonly called, is a very broad field. We have a wide variety of patients, from the youngest of pediatric patients to the very old. It is a medical and a surgical type practice, ranging in problems from simple respiratory infections to hearing loss to complex head and neck surgical issues, meaning head and neck cancers that require a great deal of surgical knowledge and a lot of planning and as far as treatment courses and all go. In my line of work, I think the thing that I like to do the most, that I seem to have gravitated to, is sinus issues. Here in Mississippi, it's almost universal that most people have sinus problems of some type or another, and there are many of those that do not respond medically that will eventually require surgery to help alleviate their sinus problems. So I do a great deal of sinus work. Also a lot of work with children, ear infections, throat infections, tonsillectomies, and things of the like. I do think that patients really appreciate the fact that I'm very succinct with getting to the root of their problem and treating their problem. I do feel that they are probably a bit more educated after encountering me, because I do explain things in great detail for them. And it's amazing that how much they do appreciate that. And instead of just being given a treatment plan, tell them about how it's going to work, what to expect, go over the anatomy. Most people are very appreciative of that. Dealing with a large number of pediatric patients, you've got an anxious patient, certainly a child, but more importantly, you've got very anxious parents of these children who, for many, the first time that anybody in their family has had surgery, and certainly the first time they've had a child that's had surgery. So explaining things in great detail helps alleviate that anxiety a great deal.